Hi, very good evening to everyone. I'm Professor Xiao, the Dean for School of Dentistry in IMU. A very good evening to everyone and welcome to the webinar to share some information on our postgraduate program in implant, in prosto, and also in endodontics. All right, we have a esteemed panel with us today. We have Associate Professor Dr. Pravin Kumar Patir, Dr. Shaker Bhatia, Dr. Ranjit Ajit Bapat, who are the program directors for these three postgraduate diploma programs in dentistry. So before we proceed to the webinar, I would like to share some housekeeping rules. We have muted the microphone for all attendees. And for questions and feedback, please use the Q&A panel at the bottom of the Zoom webinar page. And this live webinar will be recorded for feedback and review purpose. So first, we would like to welcome Dr. Pravin Kumar Patil, who is the Program Director for the Postgraduate Diploma in Prosthodontics. So Dr. Pravin Kumar Patil at the moment is the research cluster head in IMU School of Dentistry for implant dentistry. He is an examiner for the Royal College of Surgeons, Edinburgh, and also ITI Diploma in Implant Dentistry. He is an ITI Research Committee member and ITI speaker. He is an adjunct professor in 3 premier dental institute in India. He is also the associate editor-in-chief of the International Journal of Prosthodontics and Restorative Dentistry. And he is also the board member for the editorial board member of the Journal of Prosthetic Dentistry. He is a founding member of the Council for Prosthodontic Research by Indian Prosthodontic Society and Association for Maxillofacial Prosthodontic Rehabilitation in India. He has secured over 25 research grants from ITI, overall 25 research grants, i.e. from ITI Switzerland, the FRGS, IMU Malaysia, and a lot of other renowned research providers. He has published 150 manuscripts and reviewed over 330 manuscripts. So with this, I would like to invite Dr. Pravin Kumar Patil to give a bit of insight for our postgraduate diploma in prosthodontics. Over to you, Dr. Pravin.
Very good evening to one and all. Thank you very much, Prof. Xiao, for a kind introduction. With this, I will start my presentation and I'll be taking up the postgraduate diploma in prosthodontics out of 3 diploma courses we run in IMU here. So when we talk about prosthodontics, we talk about the skills, we talk about the knowledge, we talk about the overall rehabilitation of a patient as a holistic way. So with this, this diploma basically is developed for the private dental practitioners who are private practitioners, busy practitioners, and they just need to come for a couple of weeks, almost 6 weeks in a 1 year, and then the remaining time they can go and practice in their own clinic or they can come back to the IMU. So I'll be taking you the basic introduction about the program structure and what are the activities we are in general taking up with our existing 2 cohorts for postgrad diploma in prosthodontics. So as a structure wise, this program is divided into 2 basic types or categories. When one can say one is a full-time with a 1 year and the part-time with the 2 years. I'll be discussing a little bit more about that later on. So the School of Dentistry has started this diploma 2 years back, and we are running the second cohort already in, and then we will be welcoming the third cohort in November 2023 now. So as I mentioned about the full-time and part-time. Full-time, you don't need to confuse about this program. Even if it is a full-time, it's a 1-year program. Within that 1 year, you need to just finish your 6 weeks of teaching activities in IMU. And those 6 face-to-face activities or face-to-face modules are spread with the gap of generally 2 months of apart they are. And then in between those face-to-face weeks, you will be free to perform your clinical cases in IMU or in your own clinic. So part-time is also considered as a similar structure program with all 6 modules needs to be completed in 1 year, and then you will be given a chance to complete your cases in additional 1 more years, and then you can take up your exam after 2 years. So that's basically the basic difference about it. So when we talk about the diploma, why you need to be here in IMU for learning this diploma in prosthodontics. We have a Malaysian qualifying agency accredited program, and we got 5 years of accreditation for this program to run. And then that's where we are actually being evaluated and given the evaluation by the Malaysia's premier qualifying agency. IME being one of the most established and first private medical university, we also do give a valued course content and variety of delivery methods with a flexible learning options, with a high quality and qualified experienced staff members. And we provide a huge amount of free access to IMU's online library as well as online resources in related to the subject, including prosthodontics and implant dentistry. We have a state-of-the-art digital technologies here to go, including the CAD/CAM facilities and then the CBCT technology to enhance your patient experience and speed up your quality of the treatment. So overview of the prosthodontics. In general, this course is actually designed in amalgamation of knowledge and skills, where knowledge has been delivered and then task has been completed by the candidates when they are here in IMU for 6 face-to-face modules within spread over the 1 year of time. And then this curriculum is also designed to enhance your skills in prosthodontics or which are based on the evidence-based and patient-centered prosthodontic treatment options, including partial as well as complete edentullism. So we are basically training these students in the understanding that you need to perform some oral rehabilitation procedures for aesthetics and function by selecting the appropriate dental materials and instruments, different clinical techniques, multidisciplinary approach for patient care, and also management of complications and failed prosthodontic cases. So when you look at the structure, this is divided by 2 semesters. Semester 1 of 15 credit points, semester 2 is of 15 credit points. So semester 1 is spread around 6 months, and then semester 2 is spread around 6 months. So in semester 1, there are 3 modules, and every module is inclusion of 5 to 6 total weeks. For every module, the first week will be face-to-face. That's how the structure of the program works. So module 1 is fundamentals of prosthodontics and patient-centered care. Module 2 and 3 is a partially edentullism. In module 2 will be mainly concentrated the treatment procedures, including the fixed prosthodontics, removable prosthodontics, and then the module 3, partially edentullism, where rehabilitation of these cases with the partially dented patients by fixed prosthodontics. In semester 2, we'll be having module 4, 5, and 6, where module 4 comprises of treatment modalities for completely edentulous patients. Module 5 will be covering multidisciplinary treatment approach, including other disciplines of dentistry to rehabilitate the patient as a whole. And then module 6 is an important one, where we including the management of complications and failures in prosthodontics. So each module comprises of 5 credits, totaling of 30 credit program. So as is also discussed earlier about this program of a full-time minimum 1 year or part-time minimum 2 years. Or you can take maximum of 2 years for full-time program and maximum of 4 years for part-time programs. So one can enroll as a full-time candidate and you are having a maximum of 2 years to give exam and complete the 10 completed cases with the varieties of different disciplines, like including removable processes and aesthetic restorations and anterior and posterior restoration, including partial and edentulous and complete edentulous patients. So for whether you are joined full-time or part-time, within first year of activities, your all teaching modules, the face-to-face modules will be completed. So then remaining number of years, whether for full-time it's another 1 year and for part-time another 2 years, will be used by the candidates to complete their case quota, and will having minimum of 10 prosthodontic cases to complete these cases. Now, having said that, if you are really enroll as a full-time candidate and struggle to complete your 10 cases in this program, you can always write to the program director and the school to extend your or to shift your full-time program to the part-time program, and you can have additional 2 more years to complete your cases, and within the span of those years you can keep ready and appear for final professional exam. So teaching and learning activities, when we talk about, we have a face-to-face lectures, we have online learning resources. No matter whether after face-to-face weeks, when you go back in your clinic working there, we still engage you at least once in a week for some online learning activities. We call it as a self-directed learnings and then guided learning sessions, in which we keep discussing some of the evidence-based literature and then some case discussions and so on. So in a way, it's an intensive program. Though you are also working in a private practice, we'll be engaging you in some other way by looking at the online cases. In that as well, you are free to come to IMU and see your any supervisors to discuss the cases face-to-face as well. We have some seminars. We have a case-based learning as a very major portion of the teaching learning activities. We have a number of clinical sessions, and these clinical sessions are already been timetabled so that you know which session can be used to treat your cases in IMU's oral health center. In addition to that, you always are free to call your patients based on the supervisor availability and the clinic availability. In addition to that, we have a task-based learning. These TBLs are major component of your face-to-face activities, where lots of practical hands-on workshops will be conducted, and that's how the program teaching learning activities are. When you look at the faculty members, we have renowned professors, Professor To Chuket and Professor Xiao Liang Lin, who is also our dean. Both are restorative and prosthodontists and well-known in Malaysia, and you can take help of their a huge clinical experience, and you can approach them anytime during the whole school course of the time, including myself. Dr. Harshvardhan Arya is another visiting faculty from India, who is a key opinion leader for CEREC CAD-CAM technology, and he's quite well known in a CEREC CAD-CAM technology, and he'll be coming 1 or 2 days to be with you in module 3, and that's how you can get some other experience in digital technology used for prosthodontic treatment approach. Dr. Mandakini, Dr. Shivani, Dr. Nafis, Dr. Insi, all are prosthodontists and been trained with the different countries, and we have another prosthodontist, Dr. Minati, on board as well. So these are the well-qualified prosthodontists will be teaching you. Apart from that, we have clinical facilities. We have library, online, on-site library, and oral health clinics spread about multiple chairs, dental chairs. And for postgrad diploma, we have a kind of designated to all-time clinics, which you can take help of that. In addition to clinics, we have online academic campus, which is an international term for implantology, ITI online academic campus, where you can enjoy a little bit of implant-related literature, which is given free for you to access and to learn basic prosthodontic aspects of implant dentistry. We have intraoral scanner in functioning. We have intraoral microscopes if you want to use it for practical or clinical purposes. Cone beam CT scan is available, and then your CAD/CAM machine, and then digital planning software as well. So all these digital technology is well in function, and we usually encourage students to use these facilities in IMU. Apart from that, we have clinics which are well equipped. Of course, we run an undergrad clinic as well, but having said that, we are also have some separate rooms for postgrad clinical usage as well. So apart from that, we have a dental skill lab where most of our practical hands-on workshops are being conducted, and those are in general happened during the face-to-face week's time. So assessment components for this program, once you finish your teaching learning activities and face-to-face modules, and then we have a portfolio of 10 cases. There are 3 more case reports needs to be submitted, and these are addition of these 10 cases. So portfolio comprises of different cases, and then case report is the 3 case reports needs to be submitted as a final assessment. We have a short answer question exam, OBA, and then objective structured clinical exam, and 1 best answer clinical exam as a final professional written test. Yes, so this is the gross professional examination structure. And this exam comprises of theory and clinical components with a different weightage at different module level. So case report 1, 2, 3 comprises of 10% each as a clinical component, and then we have written theory. In-course assessment theory comprises of 10% more in module 3, is halfway through end of the same one. And that's how we will continue to end up module 6 with a final professional exam with the OSCE 40% and then 20% of written theory exam. So that's how the theory comprises of 30% and clinical component comprises of 70%, and total weightage becomes 100 that way. With this, I conclude my presentation, and we welcome Prof. Xiao to introduce the next speaker, Dr. Shaker. Thank you.
Okay, thank you very much, Associate Professor Dr. Praveen Kumar Patir. It's a very comprehensive elaboration on the postgraduate diploma in prosthodontic program. So we will keep all the Q&A at the end of all the 3 presentations. So do write if you have any questions, to post it up and the Q&A chat. So we will answer one by one all the questions at the end of the session. So the next speaker for today's webinar is Dr. Shaker Bhatia. So Dr. Shaker specializes in conservative dentistry and endodontics and is presently working as a senior lecturer at IMU. So he pursued his BDS from Manipal University, and he obtained his MDS from JSS Dental College in Mysore. He is actively involved in providing clinical expertise in endodontics, both for primary and retreatment cases under dental microscope since 2010. He was appointed to the rank of captain in the Indian Army and was awarded the Best Academic Lecturer Award in 2014, 2015, 2019 at the Faculty Appreciation Week at IMU. And he also received the University Teaching Excellence Award in 2016. He is a sought-after, well-known speaker in the field of endodontics and has conducted numerous lectures and workshops and trained many practitioners in the field of endodontics. He is also leading workshops that prepare candidates for the MFDS Part 2 examination, a membership examination from the Royal College of Surgeons, Edinburgh. He is a holder of the Diploma of Membership of the Faculty of Dental Surgery, and he has a special interest in dental microscope, rotary endodontics, disinfection in endodontics, single visit endodontics, and different kinds of aesthetic dentistry, aesthetic restorations. So with this, I would like to pass the floor to Dr. Shaker to elaborate further on the program on postgraduate diploma programs in endodontics. Over to you, Dr. Shaker.
Hey, thank you so much, Prof, for your kind introduction. Good evening, everyone. Can you hear me? Yes, everyone?
Yes.
Yes, we can.
Okay, great. So I'll be starting sharing my screen now. So thank you again, everyone, and good evening, everyone. So after Dr. Parveen has given a very nice, elaborate description about his program, so I'll be sharing with you about postgraduate diploma in endodontics. So this postgraduate diploma in endodontics as PGT Prosto, something similar lines. So there will be few things which are like common, which I won't be repeating. Probably I'll be just telling overview and you will understand. And if you have any questions, you can always put in our Q&A sessions. So my name is Dr. Shaker and I'm a program director for this program, which is called Postgraduate Diploma in Endodontics. So as PGT Prosto, we have two pathways, which is exactly similar. We have either 1 year or which is a full-time program, or a 2 year, which is called part-time. So the basic difference again is same. Whether you are a part-time or a full-time, your 6 modules of this program will be completed within that first 1 year. And the extra time you can always take it to complete your clinical requirements, which is a part of this program. So, so far we have taken 3 cohorts. So now we'll be having our next cohort, which is a 4th cohort, will be starting next year in April 2024. So this program, as it's a combination of your knowledge as well as your skill component. So you'll be having lectures, you'll be having a case-based discussion, you'll be having seminars, and then you'll be performing a lot of clinical and your simulation activities. Your simulation activities will be happening in our simulation center, which I will show you in my later slides. And then you'll be having your clinical experience with your patients in our oral health center, which is in our university. So why study endodontics in IMU? As again, Dr. Praveen mentioned, it's one of the most established private medical university in Malaysia. Our program is, it's a very flexible learning options. So very convenient for the general practitioner who we can understand because they are busy practitioners, they have their commitments in their clinics. So it's actually designed for them, where you can actually come for that particular module, which is your first week, which is a compulsory module. You learn a lot of activities and then you can perform that in your clinic, or you also have an option to perform your clinical work in IMU under the supervision. So the whole course has been designed in such a way that it's very flexible and it's an amalgamation of a lot of activities. So the course content and the delivery will be by our all dental expert, which I'm going to show you in my next slide. The most important thing, as we know, endodontics nowadays, it's all performed under microscope, which is a very important component. So every student, whoever will be enrolling in this program, will be getting an individual microscope. All microscope individually, you will be using it. You can use it as many times, and it's very flexible. Even after the module, you want to come and practice under the microscope, you're very welcome, most welcome. You can come and start using it. You'll be using microscope from day 1, and gradually you will see the difference, how well you are equipped with that and how well you are trained with that. So our all teaching staff, faculty staff are they're all endodontists. They're full-time endodontists, and we also have a few part-times, and they are all specialist endodontists. So as I mentioned, it's a very flexible program which is designed for both as a full-time and part-time. And you can do your clinical activities in your own practice, where you will be discussing your cases with your supervisor. And also you will be doing, you can do it in IMU Oral Health Center. So this program, as I mentioned, it has 6 modules, which will be covered under 2 semesters, like PGT Prosto. Semester 1 will be having 3 modules, semester 2 will be having another 3 modules. So the total credit hours is 30. I mean to say every module will be having 5 credit hours. So total 30 credit hours. Okay. So the duration of each module will be around 6 weeks, where you have a first week of every module. It's a compulsory module which you need to come and come face to face in IMU. So the names of the 6 modules, as you see the names, you will understand it goes from the fundamental science, where you'll be learning your basics about endodontics, which probably you have learned in your BDS, but it's like a revision so that everybody is on the same page. Then comes your fundamental endodontic management of a single rooted teeth, including your single rooted premolars. Then comes your endodontic management of multiple rooted teeth of moderate difficulty, which is basically your molars. Module 4 will be rotary endodontics, where you'll be learning everything about rotary systems, different system, reciprocation, new different types of files. You'll be having lots of hands-on, lot of practice, you can do it. Then you'll be having a next module, which is a management of endodontic cases requiring a multidisciplinary approach, like endoperio, a tooth with a resorption, apical resorption, how to manage that, trauma cases, which all comes under module 5. And then module 6 will be management of failed endodontic cases in a single rooted and an endodontic mishaps, like your broken instrument, your perforation repair, how to manage your ledges, and how to retreat those cases. So you can understand that it goes gradually from easy to a little bit more complex. So our teaching faculty is you can see me. And then you can see we have a Dr. Naveen. Again, he's a specialist endodontist. We have Dr. Omar Sharif, Dr. Preena, Dr. Prashanti is our radiologist. She'll be helping you in CBCT. You will be learning about CBCT in this program, how to see CBCT. So she'll be helping us. Then Dr. Kiran, she's also an endodontist. Prof. Xiao is there also with us. She's a very well-known prosthodontist, and she'll be teaching you about post-in-core, restoration of endodontically treated teeth. Then we have Dr. Jack Lam. Again, he's a very famous private practitioner in Malaysia. So he comes as a part-time endodontist for us. He'll be also involved in program. And then we also have Dr. Abhishek. He's our Dr. Adjunct faculty. He was our full-time staff for almost 12 years, but now he's our adjunct faculty. So all of us are like very experienced in this field. I think I can say more than everyone is almost more than 10, 11 years experience. Yeah. So the facilities in IMU, again, we have our oral health center. We have our simulation lab, which will be equipped with your microscopes. All the instruments will be provided by IMU, handpieces, burrs, files, your endomotors, all different kinds of new materials, new files, everything will be provided. So microscope, CBCT, all advanced endodontic instrument, whatever your thermoplasticize, everything will be provided. So the assessment component is, I won't go into very detail because as you go through this program, you will understand, because it's a properly recognized program. It's not like a workshop. So you will go through the whole assessment, which will be, you need to submit your case report, which carries some marks. Then you need to sit for an exam like OBAs and, the final examination like OSCE. So this is like a proper structured exam, which is approved by MQA. So everybody has to go through that. So these are some of our pictures from our students, how they do it. This is our simulation lab. You can see that, they're working with microscope. And then once you have gained your knowledge, you have understood, you're learning on models, then you can perform in our clinics. So you'll be given us assistant, our DSS staff, all the instrument, everything. So you'll be working with the microscope. So this is our team, all the members, and some of the pictures from our students who have graduated, and you'll be getting a proper diploma, and you'll be having a proper convocation. So these are our just latest picture of our students who just graduated. Thank you so much. And if you have any questions, you can always tell us, and you can write your questions in Q&A section. Yeah. Thank you.
Okay, thank you very much, Dr. Shaker, for a very comprehensive explanation on our postgraduate diploma in endodontics. As I mentioned before, we will keep the Q&A session towards the end of this webinar. So please feel free to put up your questions in the Q&A chat area. All right, so we would like to welcome our next speaker, Dr. Ranjit Ajit Papat, who is the Program Director for Postgraduate Diploma in Implant Dentistry. Dr. Ranjit is presently working as a senior faculty at IMU. He has academic and clinical expertise of 16 years in periodontology and implant dentistry. So he has been a postgraduate guide for the master program in perio in India prior to joining IMU. And he has obtained fellowship in implant dentistry as well. Has several publications in renowned journals with high impact factor and in tier 1 category. He has also obtained membership of the Faculty of Dental Surgery from the Royal College of Surgeons, Glasgow, and also from Edinburgh as well. Dr. Ranjit was honored with first prize for business process improvement for implant clinics in IMU in 2018. And he has also won the first prize for research and publications at IMU in 2017 and 2018. He has also won the first prize, prize for development of new program, i.e. the Postgraduate Diploma in Implant Dentistry. So with all this experience that he has accumulated, let us listen to Dr. Ranjit Ajit Papat with regards to the Postgraduate Diploma in Implant Dentistry. Over to you, Dr. Ranjit.
Thank you, Prof. Xiao, for the introduction. And good evening, all the interested participants. Welcome for this the information session on the different specialties of prosthodontics, endodontics, and implant dentistry. And I am Dr. Ranjit Papat, currently the program director for the PG Diploma program in IMU. And I will be taking you through how is the program delivered in IMU, yeah? So I welcome you all once again. So basically this program is the first program, first postgraduate diploma program started by IMU in the School of Dentistry. And this program started in 2016. So it's almost been 6 years now that this program is running very successfully. And we have trained around more than 70 doctors who have come to IMU, you know, in terms of observation and in terms of learning their skills in enhancing their implant dentistry skills. So this program is basically a program where it will help you to gain skills in relation to implant dentistry, right from basics to advanced to complex type of implant cases. And this program basically is a full-time and a part-time program, same like your endodontics and prosthodontics. So 1 year full-time where the student will come in from the first year and will be trained across different 6 modules for implant dentistry. Yeah, the program generally starts in the month of October, and it's like a program where we start the sessions in the month of October and the students is for the exam in the next September. So it's basically a 12-month program. And this program specialty is basically, it is the first PG diploma program in KL, and it involves on-site as well as off-site sessions. The reason these sessions are developed because considering that the participants who come for this program are basically all the general practitioners who want to develop their skills in relation to implant dentistry. As all of you know, the implant dentistry program is important because implant dentistry is the outcomes are not part of the BDS curriculum, or we are just introduced to the implant dentistry in the undergraduate curricula. So implant dentistry is a process where you need to give an option to the patient as a fixed definitive treatment plan who are visiting your clinics. So to enhance the skills in implant dentistry, implant practice is a must nowadays in every clinical aspect. considering these things, this program was developed such that it helps you to develop your cognitive skills as well as the psychomotor skills. Hence, we have different types of hands-on sessions, different types of case discussions, different types of clinical observations on live patients, which will really help you to go a long way in implant dentistry. And hence, this program is basically like the endo and the prosto program, has flexible learning options. What does that mean? Flexible means you don't have to be in IMU to learn implant dentistry every day. So basically, the program is divided in different modules. So in every module, you just need to come for 5 days. And then based on the learning outcomes of those modules, you will be trained to different aspects of implant skills. Yeah. Then this program, basically the content and all the lectures and all the case discussions are being discussed by all the experts in implant dentistry. Yeah. So we have Prof. Tho, we have Prof. Sia, who are really well renowned in the field of implant dentistry. So basically, you'll be trained by highly qualified and experienced specialists. And this program is designed for people who want to learn implant dentistry, in a very comprehensive way. So to learn the program in a comprehensive way, we have divided this program into 6 modules. So every module will go from basic to advanced levels so that you develop your skills in totality in relation to safe and effective practice in implant dentistry. Yeah. And as like the endo and the prosto, most of the times each module is approximately 6 weeks, including 1 week of compulsory on-site activity to be done in IMU. So basically, when you will join this program, many of the participants, they are quite inquisitive on what all things we will learn, because implant dentistry is a very huge science. There are a lot of things. There are surgical, there's pre-operative planning, there's surgical planning, there is prosthetic planning, there is post-operative planning, once you deliver the prosthesis. So what all things you will learn at a diploma level? So let me take you through the different treatment aspects. So the first aspect what you're going to learn is about basic implantology, where you will learn on case selection, treatment planning, how you develop your implant practice, because that's the most important key thing. Yeah. How do you increase the footfalls of your patients in your implant practice? So basic implantology, right from your consent taking, your treatment planning, your case selection, how do you plan prosthetically driven implant dentistry will be taught to you during this program. Then other than the basic implantology, the next step when you go ahead is basically when you have reduced bone or when you have deficient bone volume, how will you manage? So different aspects of bone augmentation, guided bone regeneration, autogenous bone grafting, then synthetic bone grafting, how are you going to manipulate the soft tissues around the bone grafts? All this will be taught to you in this program. Going a bit higher will be your immediate implant placement, because nowadays patients, they don't want to wait. The moment the teeth is out, they want to have something which is a fixed option. So implant dentistry is one of the most important treatment where you give to the patient when the tooth is loose or patient doesn't want a empty space in his mouth. So immediate implant placement has become a very key treatment option for every patient visiting your clinic. So these things we are going to teach you, where you'll be trained on what are the different aspects you plan in relation to immediate implant placement after extraction. And this is an era of digitalization. Everything in every field, digital aspect has taken over. Same way in implant dentistry, for many years now we have been doing this guided implant placement. So at a diploma level, you will be also introduced quite early in the program on how do you plan implant placement in a 3D manner, yeah, which is called as guided implant placement. So you'll be specially aware for implant placement in relation to your bone, in relation to your opposing occlusion, how do you fabricate a stent, and how do you print it. And basically, you'll be also trained on how to place implants, through these guides. So quite early in the program, you'll be learning a lot of things: basic implant dentistry, bone augmentation, then immediate implant placement, guided surgery, and also we are introducing to all of them now the protocol of DENSA burrs. So basically, for deficient bone volume where you want bone expansion, we'll be training you on the use of DENSA burrs in implant dentistry. Going ahead, the next step after basics to advanced, we will go to different type of complex cases, which is full mouth rehabs. Full mouth rehabs will be guiding you on how exactly you plan, what are the different classifications in relation to approaching a full mouth case of implant, for implant prosthesis. How exactly, what are the different parameters you consider for a case of full mouth or fully edentulous implant planning. And then going the last step, which is a more complex type of cases, which is direct sinus lift surgeries. Okay, so these things, if you see, we're covering every aspect of implant dentistry, right from basics till the advanced type of implant cases. Yeah. Coming to the prosthetic options, again, implant dentistry is basically nothing but replacing a missing tooth. Okay, so basically prosthesis or prosthetic options will really play a very important role in replacing those missing teeth. Although surgery anyone can perform after you develop your skills, prosthetics is the most important, where you will have most of the complications. So how exactly you plan your prosthesis, what are different types of ways you record, you measure, you have the impressions now, and you also have the scope of doing digital scans now in IMU. So you'll be trained right from the basic conventional way to the advanced digital way in implant prosthetics. So basically, these things are all divided into these 6 modules, which is the fundamentals and communication, which is module 1, where you are trained on also developing your communication skills and the basic implant dentistry. Then module 2 is partial edentulation. Module 3 and module 4 is basically complete edentulation. Module 5 is something, which is again a hot topic, which is entrepreneurship. So basically, it's just not about placing implants. How you attract the customers to your clinic and how do you convince them for implant dentistry. That is also a different ball game. How you build your implant practice. So we will give you the tips and the tricks of developing your implant practice on a longer run, once you have joined this program. So again, I mentioned we have quite experienced faculty, Prof. Sto, Prof. Sia, who are also there in the prosthetic PG diploma. We have Dr. Praveen, who is also a well-renowned prosthodontist. We have Dr. Shivani, who is a great prosthodontist. We have Dr. Prashanti, who is a radiologist, who will help us in CBCT analysis, and then the guided planning, how you trace the nerve, the basic things. And also we have Dr. Pitui and Dr. Insi, who are quite very well experienced implantologists. Again, same like the endo and the prosto, we have all full-fledged infrastructure and resources. We have a dedicated postgraduate lab, for the PGs to come and do the different type of hands-on sessions. You can come anytime. If you're not confident, do the practice sessions, repeated practice sessions, get your skills to the best possible way in this program. Again, people who join this program have added benefits of using the ITI online academic campus. So those who join this program will also be given a free access to the ITI website. So ITI is basically the international team of implantologists, where you get access to all the best of the science from all the specialists in implant dentistry, right from your different videos. Then you have different newer concepts of socket shield, bone grafting, all these techniques. You can actually watch these videos from the specialists in implant dentistry on this online platform. And again, we have the software planning for guided surgery and the basic CBCT, which is required for each and every implant case. Same like the assessment, assessment drives learning. There's no program which is complete without assessment. So just to test your knowledge, we'll be having very, approachable and easy assessment components, which are not very, very stressful. As practitioners, we will keep them quite, able to attempt with. You will develop a big portfolio of 6 cases. You need to complete 6 cases in this implant program, right from start till the prosthetic delivery. So you will develop a nice portfolio of 6 implant cases, which are which have different case mix. Then you will undergo few assessments for case discussions, then treatment planning report, and also at the end you will have some practical examination on the OSCE, which is the objective structured clinical examination. Basically, just to share a small video, what is our journey as a team? We are a team of different faculty of different specialty, carrying on different hands-on on the goat jaw and the preclinical lab. This is by Dr. Jarin, who's a periodontist from Singapore, as an external speaker. Then we have different lab sessions. We have clinical, so you can come to IMU and do your patients. Yeah, that's the most important catch in this program. You can do patients in our clinic. Before you do your patients, you develop your skills in the lab, and then come to the clinic and the next step, which is the patient service. And this is our wonderful team, yeah, for PGDID. So to come up with, we also have a design this course as a starting course for PGDID, where you can come for this course in the month of August from 11th, 12th, and 13th, and gain a good amount of exposure on different aspects of implant dentistry, where you will have hands-on course as well as didactics on different aspects of lab design, bone augmentation, then computer-guided surgery, sinus elevation, soft tissue management. Yeah, so you can come and gain the opportunity to learn how exactly developing your clinical skills. So you can utilize this opportunity to come and train yourself in this course. Then always, for any information, if you want to go, you can visit IMU website for the information on the different delivery patterns for these 3 programs. What is the fee structure? What are the enrollment process? What is the eligibility criteria? Yeah. So once again, I thank you, IMU. Thank you, Prof. Xiao, and all my colleagues. And thank you to you, the participants who have come, and I hope we have given you a lot of things in all 3 programs. And I hope, as per your expertise and as per what you want to develop your skills, you join this program and gain all the opportunity for your career. Thank you so much.
Okay, thank you very much, Dr. Ranjit. And I would also like to thank the rest of the panel into the postgraduate diplomas in Prosthetic Dentistry. Couple has graduated 2 years ago, and after completed the first year of compulsory service, and he's thinking of doing specialization, but indecisive between implant dentistry and prosto. Can Dr. Ranjit or Dr. Pravin share a bit of insight on this?
Yeah. Okay. Thank you, Prof. I'll take this question first, and Dr. Ranjit can follow me. Yes, you are on the right track of thought process, I guess, because but it's about prosthodontics, a higher umbrella where you can have a different aspects of treatment modalities of teeth and so on. Scope, not just implant dentistry, but there are some different aspects of removable and fixed restoration options and so on. If you are very good at surgical aspects and you want to flourish in because implant dentistry, of course, is everyone is now booming with their clinical expertise. But yeah, so you need to really take the path where you are. Implant dentistry, to me, will be a little more specific in a direction. If you have a very much of good interest in both surgical aspects as well as the prosthetic aspects, then yes, you should go for implant dentistry. If you are really keen on just becoming a very broad spectrum restorative dentist, then join prosthodontics. Dr. Ranjit can highlight a little bit more on his thoughts.
Yeah, I mean, every specialty is important, to know. Prosthodontics is equally important. As I said in my presentation, prosthetic dentistry is very important because to replace an implant, to replace a missing tooth, the tooth has to be properly planned, which is prosthetics. And below that is your implant, So prosthetic basics are very important. And as I said, as per the interest, the field can be chosen and you can develop your skills.
Thank you so much, Dr. Prosto, and also implant dentistry as well. So if you put it simply, prosthodontic is a bigger bubble in a way, or specialty, and implant dentistry is part of the subset of the big prosthodontic specialty. So it is part of the treatment planning, to replace missing teeth. Implant treatment module is one of the module that you can use to replace missing teeth. All right. So we would like to go on to the next questions. The next question is over to Dr. Ranjit. For the implant dentistry, if I were to do my cases in my own clinic, how do I do the patient log, and how will it be recognized as a proper study log?
Yeah, I mean, it's a very valid question, yeah, because as I said in my presentation, it's a flexible program. So if you want, if you have a case in view, so for what we have done is, what provision we have done is, we have appointed clinical supervisors, as per different regions in Malaysia, so they can come to your clinic and they can observe you, yeah, in case you want the supervision for proper guidance and treatment planning and implementation of your implant cases. Other than that, also, once you hone your skills in implant dentistry under this program, once you do 5-6 cases, and you feel that the straightforward cases can be done by you on your own, then you can discuss the case with us and do it on your own in your clinic also, provided we approve the supervisors from IMU that the case is a very straightforward case and it is doable by you independently in your own clinic. So as per your expertise, what you develop, the decision can be taken by the supervisors in IMU, whether you require a supervision in your clinic from external supervisor or you can do it independently. So we don't have any much of restrictions. If you develop your skills fast in implant dentistry, you are free to do independent implant practice in your clinic. And those cases can be considered as a part of your logbook. Also, I would like to add, this program doesn't go by any system driven. So any system you do, we accept it. It's not that because in IMU, we have specific system what we train the students. But if you are doing a different implant system in your clinic, we do accept it as far as the science is been done in a correct manner and a safe manner for the
Okay,
patient.
that's great. Thank you so much, Dr. Ranjit. The next question maybe Dr. Shaker can help the participants. Will notes be provided for the assessment as well as books, or recommended to read, and assessment will be based on the book for the graduation?
Yeah, thank you, Prof, for the question. Yes, correct. So in any of the program, actually, whether it's an implant, prosthetic, or endo, you'll be given all the lecture notes, and all this lecture whichever be taken by the staff member will be uploaded in our e-portal system. So all the student will be having an access to our intensive e-portal. E-portal is basically like e-learning. So you'll be given the references of a particular program, whether it's an implant or prosthodontics or endo, will be provided to you. As we have mentioned, all three of us, IMU library is an extensive library. We have almost every article, whatever you want to access, a lot of ebooks. So don't worry about that. Everything will be provided. Yes. And our rubric system, we have a rubric system in a way because as we mentioned, it's an MQA registered program. So we have a proper blueprint for all the learning outcomes, and we will be sharing with you from which learning outcome the question will be asked. So all the guidance will be provided so that you don't lose the track, and everyone who is there will be there to help you for that. Yes, Prof.
Okay, thank you so much, Dr. Shaker. The next two questions, I think I will take it and I will lump both together. The first question is, may I know if the postgraduate diploma is recognized overseas? And then there's another question saying that the practitioner plan to take the ADC licensing as the family is moving to Australia in the next few years. So will taking up the PG diploma in implant dentistry be useful in my application? So for the first question, that postgraduate diploma is recognized in overseas, I'm not sure what sort of recognition you are referring to. If I take it that you are referring to recognition as a specialist, then this postgraduate diploma is a one-year program, and I do not think that it will accumulate to be eligible to be recognized as a specialist, but it is a stepping stone to be a specialist. So you will be armed with knowledge and skills that would enable you to proceed further to specialization in the field that you have chosen. As for the Australia Dental Council licensing, usually in all the countries, the count IE at a dental practitioner level, and they require some documentation pertaining to the undergraduate program that you have taken. So taking up the PG Dip in implant dentistry will enhance your knowledge and your skills in implant dentistry, but may not be so directly pertaining to having knowledge at BDS level. All right, so the next question is, nowadays technology moves so fast and also materials moving so fast. So a lot of different companies coming up with very innovative equipment and also material as well. May I know if IMU is partnering with any company in the teaching of all this program? So maybe one by one, the program director can take this. Maybe Dr. Praveen would go first, and then we'll go endo and implant.
I lose the track, Prof. This is about?
This is
The-
about if IMU has any collaboration with any companies.
Okay, yes,
to
right,
deliver
yes.
the program.
So, yeah, thank you, Prof. So, about the program, we have each program has their own industry partners and related to, for example, if prosthodontics is there, there are Dentsply, a company which is in support. There is a Shofu company is in support to supply the teeth sets or whatever different lab-based materials and equipments. Dentsply, we do have a external speaker from India who is their own key opinion leader, and then so they also keep on supplying their own CEREC CAD/CAM machines on loan basis to during the face-to-face weeks, and then students have huge experience in handling those even in intraoral scanner. So you can have a different feel of different companies scanners or different we do have our own CAD/CAM machine, but then they also keep chair side CAD/CAM on board for prosthodontics.
Yeah.
Okay, Dr. Shaker.
Yeah, so it's very important because as Prof mentioned, because it's our field endodontics or any branch is like, we are getting new materials, new instruments and all that. So like that in endodontics also, we have a good tied up and we have a very good relationship with the companies like Dentsply. We have a Carl Zeiss, and Dentsply is one of the most innovative or one of the most highest, we can say, which do a lot of R&D with a lot of products and all that. So apart from that, we have a very good relationship with other companies as well. I think most of our team members and the faculty members are somehow key opinion leaders for different companies. So we have tied up with even Colton, they can help us in getting new instruments, new files and all that. So not an issue. Plus also, new MTA materials, like, different companies, they support us. So we have a very good tied up with companies. Yes, Prof.
Dr. Ranjit, would you like to add on?
Yeah, same like, for implant dentistry too. Industry partners are the most important people who are going to help us, to give good care for our customers, for our patients. So we have Straumann, who is one of the most important backbones, because they are providing with a lot of digitalized, services for this program. For all the digital guided implant surgeries, Straumann is the one who's going to support us. And we also have Dentsply, who've been supporting us for the past few years now, who's our industry partner for more than 5 years. And Straumann also has recently joined for the past 2 years. So these two people are the main industry partners who are going to support us in all the possible way for the program of implant dentistry.
Yeah, Prof, sorry, Prof, just one more thing, our most important, our Zeiss, Carl Zeiss.
Yes,
with
correct,
the microscopes, and microscopes, the Carl Zeiss one. So we have a very good support from them, and
Yes.
because we also have our own Zeiss microscopes.
Yes, absolutely. Thank you for pointing it out, Dr. Shaker.
Yeah.
So we have our tabletop microscope in the preclinical lab to help ease your training using microscope, and then we also have the
Clinics.
clinical
Yes,
microscope
yes.
in our clinic as well. Yep. Thank you so much. And also, there's another questions asking. So I am so glad to see that IMU has a lot of state-of-the-art equipment. So let's say during the face-to-face week, there's only 1 week. It's quite short. You know, can I come in to use this equipment during other times?
Yep. So I can.
Dr. Shaker?
Yeah. Okay.
Yes.
Yes, so the answer is yes, definitely you guys can come. That's why we said in the beginning also our program is very flexible. We understand you guys are like, practitioners and everybody has their own flexible type of learning, mindset, and you want to practice more. So you guys are most welcome. We have our microscopes are kept and we have our simulation lab designated for you for our PG. You just need to come, take instruments from our dispensary and practice as much as possible. Uh, you just need to come and just take instrument and start doing it, and everything will be provided again. So and even the staff members, who will be on the board on that particular time and particular that session will be definitely helping you and guiding you.
That's
So
wonderful to know.
Yes.
Yeah.
Yeah.
Dr. Praveen?
Yeah, even from prosthetic point of view, we have our full swing dental technology lab, and then you can come anytime, take help of our experienced dental technicians. You want to do some lab work on your own, everything is available, and there's not any restriction. You can come anytime during your studentship. Face to face is just for your condensed, compact practicals, and there is no other way to learn other things. We are teaching quite a lot for those intensive weeks, but yeah, the remaining weeks are all open for flexible learning.
That's wonderful. Thank you
Yeah.
so much. Dr. Ranjit, one question. May I know what implant planning software is available in IMU?
So currently what we are using is, when the student comes for the first time, we first train them for the analysis of the basic use of CBCT. Once they use it, then we go to the next level, which is the software computer guided planning. So currently we're using co-diagnostics from Straumann, which is quite a comprehensive and a very easy going software. So the participants will be trained on a special 1-day session on a guided implant planning. So half a day will be on guided implant planning, and half a day they will be trained to how you do implant surgeries on the models, basically in the preclinical lab, by using those guides. So in a way is that before you are introduced to the patient, you train yourself with this co-diagnostic software from Straumann.
Okay, thank you very much. And we have also invited one of our alumni who has already graduated from our program, Dr. Muhammad Shah, who has graduated from our Implant Dentistry program. Over to you, Dr. Shah, to share
Thank you,
your
bro.
experience. Yeah. Thank you so much.
Yeah, it's glad to be back here. So my name is Muhammad Shariza bin Halim. I'm from Kota Baru, Kelantan. Currently, I'm working as a lecturer in School of Dental Sciences, University of Science Malaysia in Kota Baru. So I enrolled in this PGDID in 2019 and obtained my diploma in 2021. I found this program is really helping me to plan and treat my patients. Plus, this knowledge is already helping me during my supervision. Currently, I'm a lecturer. Previously, also, I'm a lecturer from 2013. So I teach in restorative dentistry for undergraduate and master in restorative dentistry students. So this knowledge about implants is really helpful. So one thing about that I notice is about dental implant is that you think you've known enough, no? But until you enroll in this course, actually, then you came to realize that your knowledge is not that very significant. So that's why I've found this program is really helping to mold me to become a better dentist. Okay. So as we all know, this program is at their own level lah, because this is the only program that currently has been certified by the MQA, and all the learning outcome they cover in this program is adequate, and it will help you to become a better dentist with a better knowledge regarding dental implants. That's all, Prof.
Okay. Thank you so much, Dr. Shah,
Yeah, you're
for
welcome.
sharing.
Thank
Can
you so
I
much.
ask, you have mentioned that you are from USM, right? So
Sure.
that means it's quite a distance to travel from USM to IMU. So
Yes.
how about patient treatment? How do you complete your requirement for patient cases?
That is very interesting because MMU has been kind enough to appoint 2 supervisors for me in Kota Baru. So I found it's not that difficult to complete the case. Previously, we need to do 10 case. So yeah, it's not a major hindrance. There are ways that we can work around it, and IMU has been very affectionate and helping me a lot.
That's great. Thank you so much.
Yeah, thank you.
Okay.
Thank you
Thank
so much.
you. So we will end the session.
Yeah,
Now,
Prof, before we end, we also would like to thank Prof. Xiao, who is actually a brain, meaning all PG diplomas are her brainchild. So thank you very much. And she's the one who has developed everything. And being part of all these programs throughout many years since the inception, I don't know, is way back many years ago. Thank you very much, Prof, and your support in always.
thank you so much, Dr. Praveen, for your kind words. So if you have any questions, feel free to, contact us for further clarification. And once again, I would like to thank all the participants for joining this webinar and also thank all the program directors who have given a very good insight into the postgraduate diploma in IMU. Thank you, everyone, and good night.
Thank you. Thank you,
Thank
Prof.
you,
Thank you so
everyone.
much.
Good night. Bye-bye.